during a state of emergency. Wisconsin did that yesterday, I think. Has there been any conversation about any sort of action in Ohio beyond what's been done so far?
Well, first of all, we do know that a federal declaration of emergency occurred, and also the governor did a declaration as well, and that would allow certain things to happen in the state, but it doesn't mean that we are in a real emergency. It just allows certain procedures. And if you want to expand on that, do you want?
Certainly, Director. So again, Steve Wagner, Chief of Office of Preparedness. And I would say that right now we have the materials that we need to be able to deal with this situation. And part of the reason that we came here was that part or a large part of this solution, as the Director pointed out, is the public, is the public's responsibility of their own behavior. So right now we're very early on, one case, and we have the resources. We've been able to do that and really do not require that kind of declaration or more dramatic action.
Can I sneak in a follow-up?
Please.
Talk about what the public's responsibility is a little bit more. I think that they're looking for as much information on that as possible, besides covering your cough and washing your hands.
So we can certainly let Dr.
We can take some more questions. So again, what is the public responsibility was your question, and I think I addressed a lot of that earlier in terms of protecting themselves through the normal hygienic methods like hand washing, protecting their cough, protecting their sneeze. And if you know that an area has a problem, self-isolate yourself from travel if you don't have to. The other piece is to, if you're sick, stay home. If you are around someone who you know is sick, to create the correct social distance, at least 6 feet. If you don't have to shake hands, do not. And follow the ODH website information, www.odh.ohio.gov. We have very current information. We are connected with the Center for Disease Control. And I think being extremely informed, listening, and practicing good hygienic. We also like to think of this whole concept of preparedness. I know right now we are focused on influenza, but preparedness is much more than just influenza. What if we were talking about a tornado? What if we are talking about a flood? What if we are talking about a hurricane? The state of Ohio, through the Department of Health, has a preparedness section which can address any of these eventualities. For us to be able to address, we then have to prepare ourselves through appropriate planning and information. And that's what we have been doing over the past 8 to 9 years. And so part of our chore also, as I said while we're having this conference, is to inform the public as to where we are. And I think right now I want the public to not be alarmed. I want them also to take care of themselves, make sure that they get appropriate rest, eat a balanced diet, plenty of fruits and vegetables, reduce the salt, sugar, and fat in the diet. All of these things are extremely important as well in terms of preparing ourselves for the unpredictable. And this is an unpredictable situation, and we will continue to inform the public.